बरोबर.
Hello.
Hello, Dr. Ranjan.
Hello. Hi. Good morning.
Good afternoon. So
Good
we are
afternoon.
waiting for one more doctor to join in, and we'll be starting
Oh,
at 2:30.
sure.
Sure. Thank you.
Thank you.
तुम voice over भेजना है। Hello, everybody.
Hi, hello.
I would like to thank all of you for being the part of this initiative. So I would like to begin today. So hi, myself, Dr. Isha Diodi, and I'm welcoming you all on Agatsa Talks. And I'd like to give my wishes on World Heart Day to everybody. Agatsa Talks basically is an initiative where we are trying to educate our audience, our users, how to be more heart healthy, how to make sure their heart is in best of health and best of shape. So today's discussion will be around basically why we are seeing such an huge surge in cases of heart attacks among young adults in India, and what can be done proactively to reduce this cases and occurrences. So as a guest speaker, I would like to introduce you to our eminent panel today. We have Dr. Sameer Gupta. He is consultant interventional cardiology and director Cath Lab, Metro Hospitals. Then we have Dr. Ranjan Kumar. He is a general physician and associate consultant in Department of Emergency and Trauma, JP Hospital. And we also have Dr. Sachin. Dr. Sachin Barbade is basically from a public health point of view, and he's a public health specialist and part of an NGO, Ekjut. So thank you all of you to join today.
Thank you. Thank you.
Thank you.
Yeah, so I would just like to start the discussion. So my first question today would be to Dr. Sameer. So sir, I would like to ask you that what are your views on the increasing cases of heart attacks in younger adults, and what do you think can be the reason behind it?
I would like to congratulate you for doing this very important talk on heart disease. Today is the World Heart Day. And it's actually one of those days when we want to all come together and talk about the various aspects and facets of heart disease. I can extrapolate from my practice in the Western world. I used to live in the US, and the heart disease in India is actually a real epidemic. It's ingrained. If I can pretty much assure you that almost all of us who are here will know at least one person who's had heart disease. Maybe your friend, your family member, your neighbor, somebody in your network has probably had heart disease or a heart attack. So that's just the amount of the spectrum of the problem. Okay. Now, young people are definitely getting affected. Genetically, Indians are prone to get heart disease almost 10 years earlier than our Western counterparts. This is also a very well-known fact, and a lot of heart attacks, the percentage of heart attacks in the younger population is much higher compared to the US or other parts of the world. There are multiple reasons for this, apart from genetics. One is the lifestyle. We're all living in this in this busy world. We don't have time to take care of our health. It often gets neglected, and that comes at the expense of bad food. All the oily food, all those tasty foods that we're all eating. The masalas and the chola bhaturas and the samosas. That's all adding to heart disease, the burden, the stress, the lifestyle, the poor exercises. Not many people are exercising. If you go out, you see a majority of the people right now have a paunch, a toned, as you call it in Hindi. So this is something, just a marker of obesity in the Indian population. Lack of awareness. They're not getting regular checkups done. They're not going out and seeking care. And last but not the least is smoke. Smoking and diabetes. Diabetes is a reflection of the lifestyle to a certain extent. But smoking, I remember reading a statistic that almost 1 in 7 Indian men smoke. They smoke bidi, hookah, cigarettes, it's chewing tobacco. So it's a pretty big and a major problem on heart disease, and there are all these different facets and all these different things which are compounding the problem.
Okay. So next, I would like to ask Dr. Ranjan. Dr. Ranjan, as you are, a general physician, and patients must be walking down to your clinic many a times with chest discomfort, and maybe thinking maybe it's a gastric issue. So what are your view here? How many younger people are you seeing visiting you, your clinics, and seeing these cases converting into a cardiac problem?
Yeah, I've read article in the last 15 years, we are seeing more people less than 40 years, like I think 2% increase, and the lesser younger people are getting heart attacks. And more cause because of these getting young people is these days more of the people are getting smoking, and the lifestyle in which they are taking late night eatings, they are not checking their cholesterol levels also, and the fitness level is low. They are not exercising properly. Also, the stress life has increased in the last 2 decades, especially the younger people due to job and other things. So these all have caused increase a number of times the heart attack in young people. So, and many people, it's become very important to realize at correct time. If you have a heart attack, we shouldn't miss a single person. So, because if you are dealing with the other things, when the person is diagnosed is the cardiac disease, the time leading to recognizing the cardiac attack and to the cath lab becomes important. So, I think most people, if any people feeling any discomfort, any chest pain, any shortness of breath, or any repetition, and sweating, they must see a doctor. They shouldn't get late by just initially talking to their families and relatives. They should definitely visit a doctor and try to get it as early as possible.
Thanks, Dr. Ranjan. So, now we are mostly talking about the urban setup. If I move towards Dr. Sachin, in rural areas, where patient may not even have the access to have, meeting a doctor straight away. In that case, what do you think, is lacking in the healthcare system altogether, and the number of fatalities that may occur because of, lack of this particular facility being provided to such patients? Dr. Sachin, let me unmute you.
Yes, thanks. Thanks for the questions. It's important questions, and just I will draw your attention towards some data regarding the coronary heart diseases. As there is a global burden of disease, estimates that in India around 1.5 million deaths occur, means 3 times more than the all COVID deaths in India due to the heart diseases. And you will be surprised that in last 15 years, the coronary heart diseases death due to the CAD are more in the rural areas. There is a 40% more increase in the deaths and fatalities among men, and 56% more in the women. So it's very surprising to me also that when I look into the data, that why there are many young and the premature deaths due to the coronary heart disease are occurring in rural parts, especially Northeast, Bengal, Chhattisgarh. And it is not due to the heart attack, but more of the due to the strokes. So, and it has a high morbidity also. And one you rightly put out that one main reason is the accessibility of good healthcare system in rural India. So that is one of the important issue, that access to the good healthcare. And second is you will be astonished that in rural India, smoking is increased, and in urban India, smoking is decreased since last 15 years. So smoking in rural part is mainly chewing tobacco, and they are used to do the toothing for the early morning and evening times. So they call it as a datun. So that is one thing. And another thing that we always talk about, the obesity is a risk factor. But for rural India, and among especially in Indians, the low BMI is associated more with the cardiac diseases. So it is paradoxical. So low BMI, you are higher risk. So same things happen with diabetes. So that's why we call it as a lean diabetic. In Indian rural settings, you will see that the persons with low BMI having more chances of having diabetes, having chances heart attacks, and other cerebrovascular diseases. So thanks.
Okay, that was quite some information for us that you just gave us with the data. So moving back to Dr. Sameer. Dr. Sameer, with the pandemic going on and the COVID scenario, what do you think has been the effects on the heart health of the people with COVID and without COVID both?
So the pandemic has certainly challenged the healthcare infrastructure of India and actually the healthcare infrastructure across the world. When you look at the heart health, it has certainly been affected. Heart patients have actually suffered a lot during the pandemic. We certainly saw in our practice a lot of patients who were having heart issues, and we told them to come to the hospital and seek care, but they did not seek care because they said, we don't want to come to the hospital because there's COVID in the hospital, or what if I get COVID? But we said, you're having a heart attack right now. This is more important than COVID. So that was certainly the case. That was something we saw in our practice, and also talking to doctors across the world. That was a similar pattern that we saw, where patients with heart problems were not wanting to come to the hospital. Also, a lot of patients did not follow up. Not everyone had the ability to do tele-OPD and tele consultation. So that was also a drawback for many patients. They continued being on medicines. The medicine should have been changed. They did not get the blood work done because they were scared of letting anybody come inside the house with COVID. So that was certainly, I think heart patients were certainly affected a lot in the COVID times. And it was certainly a challenge taking care of those patients.
Correct. So it was basically for both who were affected with COVID as well as who were not affected with COVID. So, Dr. Ranjan, if I may ask you, you must be treating, COVID patients altogether. So what are your thoughts among, the younger generation being aware about COVID, and how aware were they regarding their heart health?
Yeah, mostly the younger generation, especially in urban area, they are aware about the, heart things, but there was a lot of confusion also in the young people. Many people just having gastritis or pain, they don't want to, they're thinking that it's just a gas, or this is just acidity or muscular pain. They consult doctor late. They don't, in COVID time, they don't want to come to hospital. They don't want to even, don't want to go to hospitals or clinic. That time they were just simply denying to go to doctor because this can be a minor thing. But many times even in COVID times, we found that few people came to hospital late also, and it was a cardiac arrest. Even because during COVID, the cardiac arrests were not stopping. The patients have stopped going to hospital. They have stopped caring for their medication. They have stopped caring for their regular cardiac checkups. But the cases were the same. So many people have lost life also. But young people, there was more anxiety. Most of them, they were anxiety. But the important is that even if you have anxiety or gastric issue or just a muscular pain, it should always be ruled out that there is cardiac arrest by a simple ECG. And these days, a lot of technology are evolving that ECG can be done at home, ECG can be done at near certain remote villages. Many, especially, I will give you an example of Tamil Nadu. The government is initiating project where at Gram Panchayat level, they are developing a monitor so that it can be done and that can be sent to the nearest district hospital, or so that can help the poor people or the those who are not able to get ECG in the desired time to get recognized. If they have cardiac arrest, they can be easily shifted to next district level hospital or where the cardiac cath lab is available.
Okay. So, Dr. Sameer, like Dr. Ranjan said, how important is, early detection in cardiac cases?
Yeah, I think early detection is of paramount importance, because once you know the problem, you can treat the problem, right? Once you know the problem, you can, prevent the problem. If you prevent the problem from progressing. So I think early detection of heart disease is certainly something which is of paramount importance at a community level. If you can find something, if you know the enemy, then you can treat the enemy, you can kill the enemy. I think awareness is extremely important.
Yeah. So as you said, early detection. So what are your views when, as Dr. Ranjan just mentioned, ECG? So, what would be there, if you have a quick ECG scan done, with digital reports, sharing to a doctor, and having a regular monitoring done. So basically our idea here is the user itself can have such facility where they can quickly get an ECG, and with the pandemic going on and the reluctance to go outside, if they can share the reports, how will this help in, managing this lack of, getting, understanding the problem and then treating it?
Yeah, so I think let's if you break down the problem of the heart problem, and you can break it down into two components, right? One is the chronic problem, right? If somebody's got chronic heart disease, and where somebody is, he's got if somebody's like, what is my risk of having heart disease? That's one problem. And the second problem is, what if I'm having discomfort right now, I'm having trouble right now, what can I do now? So you don't know who's going to have the problem, you don't know when they're going to have the problem. So yes, so at that point of time, if you're having trouble, if you're feeling uncomfortable, getting an ECG at that time will kind of help risk stratifying, can give you some sort of comfort level whether the problem that you're having is from the heart or not. Okay, but getting an ECG once a month or once a week is not something which is supported by guidelines. It's not something which is really recommended, because it's not really going to show you anything. If anything, it will increase anxiety on a normal person. But if you are having trouble, if you're feeling symptoms, if you're feeling shortness of breath, if you're feeling anything which is concerning for heart disease, at that point of time, getting an ECG becomes of paramount importance.
Correct. So Dr. Sachin, there has been a lot of discussion happening, digitizing the whole thing and getting ECGs as soon as possible. In your setup, if I talk about the rural health, what challenges are you facing in this diagnosis? And, if you have such an availability, where you can get such early detections happening, how well it can help, the whole scenario in the case when it goes to the primary health or rural health condition?
Yes. As I work in most remote and rural parts of India, so we always have a difficulty regarding the ECG and its reporting. So when a patient come with us, he is already treated by the local doctors for the tuberculosis, for the chronic cough, but he has heart condition. When we diagnose with ECG and we send it to cardiologists with scanning on print machine and all these things, so we have to do that time. So the diagnosis is very important, because the rheumatic heart disease is also very common in rural India, and proper diagnosis can reduce the mortality and morbidity. One another thing is that ECG is not like a blood pressure monitoring or a glucose monitoring. It should be guided by some, I will not say the physician, but some ASHA worker or something. Otherwise, it will create a panic or anxiety, because one of the public ethics principle is that you cannot do survey without service. If there is no facility where to go, then only diagnosing the conditions, heart conditions, we will increase the panic. But these things go simultaneously, side by side. And one other thing, most important, is the prevention aspect. When we will talk about the prevention aspects of the heart diseases, and how to approach the prevention aspects through family-based approaches and through community-based approaches. So we should move towards that directions also.
Okay. So, Dr. Sameer, we have been interacting with a lot of our, the audience. So, there are many heart rate monitors. There are, watches available in the market where you are getting, heart rates, you are getting some small vital signs and all, which they think, is it something that can help to cognitively understand the heart health when you're sitting in a home setup? Are they enough? Because the market right now is populated with such devices. Or, we should move towards more specific points when it comes to heart health.
So, there are different kinds of all these different fitness trackers and fitness bands. And, there's been a lot of data which is now coming out about wearable devices. And what they help you do is they help you find if you have, especially if I will talk about one of the most commonly used watches, like the Apple Watch. They're trying to see if, they can detect irregular heart rhythm. But they're not really that useful for heart attacks per se. But yes, they can detect irregular heart rhythms on a normal basis. They have these different alerts built into the system. Yeah, for a heart attacks, you typically need a 12-lead ECG. these kind of monitors, they don't give you a 12-lead ECG, they give you a 1 or 2 like ECG.
Yeah.
And that's what the difference is, major difference.
Thanks. So Dr. Ranjan, so do you think, if we have such instruments next to, your table also, when if you have an access to a complete 12-lead ECG at the point a patient comes to a clinic, will it be helpful in your, managing the case at that time?
Yeah, definitely. It will benefit both the, patients and the doctors to recognize, because the patient, if some patient comes with chest pain, then we have to send them for ECG. Then they take out 2 hours to go to ECG facility. They get time and then get it done. And sometimes if severe chest pain, then we'll rush into emergency. So if if it's a small device that can help early diagnosis, if we can see the ECG, we can directly refer the patient to the cardiac center, so that the time that we can save, that will help heart and prevent cardiac muscle from dying. That will definitely benefit, and that will lower the chance of getting more complication of heart attack and lower the chances of mortality.
Correct. Okay. So, Dr. Sachin, I would like to ask you one more question. So, when the challenges in the rural setup, if you to how we can improve the healthcare delivery in such a setup where we can reduce such occurrences, we can get the percentage numbers that you just mentioned when we initially started the discussion, can help in reducing that.
So yes, we should definitely work towards this. And one of the important aspects to work for the coronary heart disease in rural India is more work need to be done on prevention aspects. And for that, there are good examples of the evidence and research. Recently, one good research trial published in the Lancet Global from the Kerala state, where they do family visits by the ASHA worker every month. And because they say that when we have any persons with coronary artery disease in the family, then if we are giving individual advice on lifestyle modification, diet, exercise, it will not as impactful as a whole family we are giving them, or we are treating as a family, as a unit. And if because family, they have a shared relationship, they have shared diets and shared space. One of the important thing you expect that there are we know that there are some genetic factors associated when any family members have premature heart disease. But we are now known that other family environmental conditions are equally important in preventing the future cardiac events in nearest family members. So we need to strengthen the health and wellness centers which are under the Ayushman Bharat Yojana. So because the health and wellness centers are adopted for the NCDs, non-communicable diseases. There is a huge burden of non-communicable diseases in the rural areas. And through these health and wellness centers, we should try to address the problems of prevention and simultaneously diagnosis. So because in the primary healthcare, one of the important risk factors is the adherence to the hypertension treatment, diabetic treatment, because these are the main risk factors. So, and we have seen the data from the data that there is a no adherence to these medications. No rural people have very late, because there is no way to get these medicines regularly, and its cost. So these family health and wellness centers can be a good entry point for the prevention and treatment of hypertension and then diagnosis of the sudden cardiac events.
Okay. So now we are getting few questions from our users. So we'll be picking few of them so as they can understand, exactly what queries they have. So one question, Dr. Sachin, one person has is, what is the relation between low BMI and heart disease?
Yes, I say it's very interesting, and paradoxically, yes, it's true that in India, the people who have low BMI have higher chances of coronary artery disease. And there are some multiple hypothetic theories regarding that, and these are all observational studies. So one thing that in Indian people have narrow coronary arteries. And another thing is that during the prenatal period, when you did not get enough nutrition, then your chances for the metabolic diseases like diabetes, hypertension are increased. So that may be the one cause. And when you have low BMI, there is your chances of the other stressors in the community like poverty and other social determinants, smoking, are increased. So that's why it is correlated.
Okay, thank you. Dr. Sameer, we also have one question that viewers are repeatedly asking for us is, in a younger person, a younger adult age group where we are already having the stressors in our life, corporate job, working and everything, how can they manage their heart health? What should be the frequency in their case to make sure, their heart is working fine, their heart rate, what should be normally they can maintain it, and how can they change the way their heart health can be managed better?
Yeah, so we're seeing a lot of this, right? We're seeing a lot of younger people having heart disease, and as we talked about, there are multiple reasons for that. Poor lifestyle, like you just mentioned, that we are young, busy young professionals out to make a career for themselves, meeting deadline, meeting about meeting. So it definitely becomes a challenge. But you still have to take out time for your health, and because especially heart health, because once it goes, it's difficult for it to come back. Taking out half an hour in the morning to exercise, to work out, do some meditation, it goes a long way, not just in your heart health, but also in your productivity. The other thing that that people often do is, when you go out and you see people walk, you go to the park in front of you, you go and see people walk, or in your locality, in the morning walk. When people are walking, they're just walking. It's not exercise walking.
Yeah.
So, you have to increase your heart rate a little bit. And there are various ways and means to, calculate it. You can talk to a fitness trainer about that. But, you have to give yourself some level of exertion so that you kind of get a workout per se. It should not be, subah tohlne ja rahe hain. The other thing that you can do is you should certainly get your regular blood testing. Check your cholesterol, check your diabetes, see your triglyceride levels. So, if nothing else, we'll try and help you understand where on the risk profile and risk parameters you are as an individual. What, my triglycerides are a little bit high. Let me keep an eye out for that. I'm getting borderline diabetic, or I am a diabetic and I'm just about to reach the diabetic. So let me try and make those adequate changes that I can reverse that. So instead of saying one day you land up with a heart attack, what, I have bad diabetes, is uncontrolled. I have blood pressure, which is uncontrolled. So especially in today, and Dr. Sachin over here can attest to the fact that in India, even in the rural population, there's a lot of heart disease. It's not a disease of the urban India. It's a disease of India, both rural and urban.
Correct. So one more user would like to understand, how can they monitor their stress? As stress is such an important factor that can drive you towards a bad heart health. How can that be monitored? Or how can they make it better?
How can individuals make it better?
Yeah.
By getting regular testing of themselves, right? I mean, they can make it better by regular testing of themselves, by exercising, by taking care of themselves, by not smoking. These are some of the important things, getting testing done. If you have a high family history, then, you go see a doctor, go see a cardiologist and get some testing done, whether it's an ECG, whether it's a treadmill test. So, there are various tests and various ways and means to try and detect disease early.
Correct. So, if as we are moving towards, this session towards ending, so do you think, if people are adopting this digital tools, can this help in improving both the doctor and patient receiving, the information about the patient's health? Because now people are, ready towards going toward these things, making sure, all their parameters they can check on their own and then communicate to their doctors, having that connection, because pandemic has made it possible through telehealth. So do you think, that is one more way of getting themselves under check?
Yeah, definitely. I think digitization is going to play a big role. Yesterday, our Prime Minister just announced the Health ID. So it's all towards the digitization. All the efforts are towards digitization, and the portable ECG devices will certainly be helpful for a certain subset of patients, especially those patients who have heart disease. and who are at home, or their family members have heart disease, and so that will certainly be helpful in that subset of patients, and it's definitely a useful tool. And people want to get more treatment at home. So, but to a certain extent, they also have to come to the hospital to get complete treatment. But for early diagnosis, yes, early diagnosis is of paramount importance in heart disease, especially when you're having a heart attack.
So, Dr. Ranjan, on a general physician perspective, where I think so you see a variety of patients coming from different issues. At that point, if I would like to understand one single a tip or a comment in total, how can they manage better? Being a diabetic, being a hypertensive, being a heart patient, or everything, whatever the NCDs are happening. In that perspective, how can these patients make sure their heart health is under check?
Yeah, along with managing their diabetes, their blood pressure, their cholesterol, they should also manage their stress level and their sleep time. Sleep time is also very important. They should get 7 to 8 hours sleep time, proper walking. They should stop smoking. Most of the younger generation are getting more cardiac problem because they have become a chronic chain smokers. Many of the people, especially you can see in the IT sector and many they are working in the on the night shifts, especially UK based and US based companies. So because time lag, they are getting more taking more stress, and they are not getting proper sleep. That is also leading to more cardiac problems to them. So I think if they can reduce, they can have proper sleep time. They should walk regularly. They should maintain a healthy diet, and along this, they should check their cholesterol, blood pressure, and this diabetes level. I think that will definitely help. And they can, with this digitalization, the monitoring, they can make a regular checkup and regular record, so that if they can make a ECG records of previous records, which can a single device or like in laptop, then we can monitor and we can guide them better. So it will be definitely helpful for all the persons who have a chance of higher cardiac problems.
Thanks, Dr. Ranjan. And if I move towards some final comments, Dr. Sachin, what would be your a tip on the rural health part? How can we manage our heart health better there on that level?
So according to my experience and what data and evidence suggests, that if we have to work on reducing the burden of the heart disease, we have to target the population level, not an individual level. So regarding the population level, 2-3 important risk factors if we reduce. One is the smoking, second is the control and of hypertension and diabetes. So these three things, if we work regarding with the community and family-based approach, and adherence to the exercise, physical activity, so and reducing the sugar content and the salt content. So because salt content is also a little bit higher, it is also one of the risk factors. So if we work on this on the community level aspects, then certainly because according to Sustainable Development Goal, we have a target of 1/3 reduction of the premature deaths due to the heart disease. And in India, we have a lot. In Western world, the fatality is decreasing due to the heart conditions back to 20 years back. And one of the most factor was the smoking. They have many legislative bans and other awareness programs regarding the smokings. So in India also, we need to do on that on mass scale, on population level scales.
Correct. So I think so, most of our users got their answers here, and it was an amazing session, and it was a great honor to have all of you on this platform on World Heart Day. And I think so we were able to, answer our users, and I'm expecting they are taking a lot of information today with them. And thanks a lot, and thanks everybody for being part of Agatsa Talks. And we'll be coming back with another enriching session for our users. And I would like to especially thank our speakers today, Dr. Sameer, Dr. Ranjan, and Dr. Sachin, for taking out the time from their busy schedule and coming down for this. Thanks a lot.
Thank you.
Have a great day, everybody. Happy World Heart Day.
Thank
you.